We're just a few seconds away from kicking off this lightning chat with Professor Heidi Larson from the Vaccine Confidence Project ahead of the Teach to Reach Connect 6 event that will take place on the 17th of June. Stay tuned. We'll get going in just about 20 seconds here with Charlotte Mbou and I from the Geneva Learning Foundation. See you in a few seconds along with many, many good people from the Movement for Immunization Agenda 2030. Greetings from Geneva, Switzerland. A warm welcome. I'm Reda Sadki from the Geneva Learning Foundation. This is Teach to Reach Live ahead of Teach to Reach Connect 6 on the 17th of June 2020.
And I am Charlotte Mbou, connecting from Ebolova, Cameroon. Are you involved in COVID-19 vaccination? Are you working to strengthen confidence in vaccines to improve vaccine uptake?
So at the last edition of Teach to Reach, more than 8,500 national and subnational health professionals met to network and learn by sharing the strategies they've successfully used to strengthen confidence in COVID-19 vaccination.
In today's lightning chat, we are going to discuss a few of these locally grounded strategies with Heidi Larson, who leads the Vaccine Confidence Project. We last spoke with Heidi on the 17th of December 2020 in a dialogue with thousands of members of the COVID-19 peer hub who were preparing to introduce the COVID-19 vaccine.
So a lot has happened since then, to say the least, and this actually leads to our first question for Heidi Larson. So there seems to be an abundance of reports, work in the last 2 years around vaccine hesitancy, confidence, community engagement. How does your long-standing work at the Vaccine Confidence Project at the London School of Hygiene and Tropical Medicine stand out in such a crowded space? And how has your research led to change in policy and practice?
Well, thanks, Rita and Charlotte. I'm happy to be here. And with the Vaccine Confidence Project, actually, where we have benefited in our COVID work is that we've been monitoring vaccine confidence for 12 years now and started actually measuring it globally since 2015. So it was really helpful to see the landscape of confidence when we also looked at the impact of COVID, and we were kind of comparing. The big difference, of course, is that COVID was for everybody and not just childhood. So that was one thing. But because we have certainly appreciated, aside from the global level monitoring of trends, that the reality is it's on the ground and on the front lines where confidence happens or doesn't. So we've really been spending our years building out global and local networks, including our collaboration with the Learning Foundation, and it's really there that we've benefited from a lot of listening, but also sharing a lot of things we've been learning and connecting people. We've really been trying to connect people and move into novel interventions. The big challenge, of course, is social media. Over the 10, 12 years, there's been more and more social media, fast-moving information and misinformation, disinformation. So we need confidence building more than ever.
All right, before we go to Charlotte's first question, I want to pay attention and acknowledge and warmly welcome a number of leaders from the Movement for Immunization Agenda 2030 who have joined us in our Zoom studio. I will look forward to seeing your greetings right now, but then your questions and comments as we progress through the discussion. Samuel Jack Reese, who says, "Good day, everyone," joining from River State, Nigeria. Gladys Abena Owusua, connecting from Ghana. Hawa Buhari from Sokoto State, Nigeria. Dr. Syed Mehraban Shah from Afghanistan, and Joyce Murithi from Maryland in the United States, who says she's glad to be here to listen about and to learn about COVID-19 vaccine confidence. So Charlotte, you have, I believe, the first question or the second question for Heidi.
Definitely, Reda. Heidi, has the COVID-19 pandemic led to an unprecedented surge in vaccine hesitancy, as many practitioners seem to think? Given your long view of the issues around vaccine confidence, what do you see has actually changed with respect to vaccine confidence? Beyond vaccine acceptance and uptake, what are we learning about the question of trust in our societies? What is the point of measuring this?
Well, thanks, Charlotte. There's a few questions in there that you've asked, but I think that the point of measuring and monitoring trust and confidence is to be alert to when it starts dropping, or when we see it moving up, to try to understand what did they do that helped build confidence that we can share with others. So that's really, I think, the value of monitoring it. Yeah, well, sorry, you had a few questions packed in there. Can you throw out one of the other ones?
Yes, has the COVID-19 pandemic led to an unprecedented surge in vaccine hesitancy, as many practitioners seem to think? Yes,
yeah, okay. Well, let me start by saying the introduction of the pace and introduction of a new vaccine with COVID has been an overwhelming scientific success. And the reality is that over 10 billion people in the world have been already vaccinated within not even 2 years since the vaccine was introduced. So at a certain level, it's a success story. The big failure is that Africa, which was very much in equal need, was included, and that was a big failure. In terms of the increase in the spread of vaccine hesitancy, yes, it has, and that's partly because what were typically vaccine conversations about childhood vaccine, less so about adult vaccines. There was more, the lower rates of adult vaccination were more due to complacency or access. But with COVID, because it was for everybody, those conversations went into all kinds of forums and circles that people that weren't paying attention to vaccines before, and all of a sudden were. So we did have certainly a bigger challenge, and new vaccines always provoke a lot of questions. And I think there was also mixed in with that anger and resent and distrust, particularly in the inequities and injustices around the distribution of vaccines.
Thank you, Heidi. Let's go now to Esfundo Gratitude from South Africa. Esfundo, you are a leader in the movement for Immunization Agenda 2030. You wrote in the chat, how do you build confidence in a society where social media is full of misinformation and fake news? Can you introduce yourself and tell us why is this of concern to you?
Is this to the person questioning to introduce?
Yes, yeah. Esfundo, yes, are you able to speak to us? We'd love to hear from you. All right, Esfundo may not be able to speak to us, unfortunately. So let's go to Joyce Murithi. I know it is early for her. She is originally from Kenya and working currently in the United States. Joyce, are you able to speak to us? And then we have a comment from Boma Otobo from Nigeria, who says, Heidi, hello. Thanks for the knowledge your research will add to the entire global view about vaccines. Is the social media playing a positive or negative role in allowing people to make the needed decisions about their health as far as COVID-19 vaccines are concerned? Can these roles be sustained if they're more on the positive side? So let's try before we get, I think you're getting the gist of the questions from these health professionals. Yeah. Joyce, would love to hear from you. How are you doing? Do introduce yourself and tell us what's on your mind. We have here someone who has dedicated a significant chunk of her lifetime to the study of these issues around vaccine acceptance, vaccine uptake, vaccine confidence. Joyce, how are you doing? What would you like to share?
Thank you very much, Reda, and thank you, Professor Heidi, and everyone who's joining us today. I think I'm very excited to hear that Professor Heidi has put a lot of work into looking at the confidence issues around vaccines. I just wanted to find out what was the difference? What did you find to be the difference between vaccine hesitancy during this time with COVID vaccine and other vaccines that have been rolled out? Because the confidence seemed to go so low, and it cut across boundaries, it cut across cultures, it cut across religions, and many other sectors in the community, and people could not agree about the benefits of COVID-19 vaccine. And we've had vaccines throughout, at least for me, throughout my life, but this was just very, very different.
So you want to know what was different. Let's take one more question. This is from Samuel Jacques. Samuel, do introduce yourself. Tell us which city and country you're connecting from, what you do with respect to COVID-19 vaccination, and then tell us what is your comment or question for Heidi Larson. Samuel, are you able to speak to us? Your microphone is unmuted, but right now we're not hearing you. All right, and Spundo, is in the same situation. They both have problems with their microphones. So I think we have at least three questions, Heidi. First, on social media disinformation, the sort of, so what does the evidence actually?
Good afternoon.
I think that's Samuel trying to.
Yeah, Samuel, unfortunately, I think your connectivity is not going to allow you to speak. So I would suggest you write your messages in your message or question or comment in the chat. We would have loved to hear from you. Good
morning, good afternoon, good evening.
Yeah. Go ahead, Samuel. Let's give it one last try. All right. So social media, what's specific or different about COVID-19 vaccine? And then to go back to Charlotte's question, how does that relate to the question of trust more generally, Heidi?
Well, I think that, as I was mentioning earlier, the big difference with COVID vaccine is that it was for all ages and everywhere in the world. None of our previous vaccines in the last century, certainly since we had a global mass vaccination program with a brand new vaccine for all ages. And I think just the sheer fact that everybody in the world had to think about this new vaccine or one of the various COVID vaccines, that opened the doors to information flowing. It could and should have been an opportunity to build hope and confidence in vaccines, and really, get the world to rally around the value of vaccines. Unfortunately, we were very late with our communication globally. The communication about these vaccines didn't really get going until the vaccines were close to being rolled out. And I personally think we could have gotten started earlier, but that's, as they say, water under the bridge. We've got to build on what we have in front of us. I think the important thing in terms of where we are now is we learned a lot about where the issues are. The vaccine conversation jumped onto a lot of political debates, on other debates, and we're going to have to rein it in, as they say. But we're not. I think we've been focused a lot on social media, but people still talk to each other. People still gather. A lot of places have very little social media, but it takes one bad or negative WhatsApp to go viral around the campfire, read on the radio, read in the pulpit by the priest or by the imam or whoever. So I think we cannot lose the plot on all the face-to-face and other more traditional forms of communication to surround these negative rumors. Of course, we should do what we can to have a more positive environment around. Well, I don't want to just say positive because it needs to be accurate. It needs to be sensible. We also need to understand what are the issues that people have, because trust is relational. Trust is about issues. And if we don't understand where the trust issue is, to say, I don't trust government, it doesn't help us understand, well, what is it about government? So we need to go deeper with that. But I really think we have to look at the bigger communication ecosystem. And the biggest success stories I've seen in the world during COVID have been hyper-local.
And Heidi, so here you are addressing a group of health professionals, deeply committed, deeply engaged, many of them in COVID-19 vaccination, all of them in ensuring that that bond of confidence with communities, continues to grow from strength to strength. What do you think is their specific role in the last 2 years and then going forward? What is the best way for them to continue to remain the most trusted advisors of communities, individuals, families?
Well, health professionals still, in all the trust measures that I've seen, and we really keep an eye on them as they emerge, are still ranked the highest in who's trusted, certainly above government, above media. Employers have come up in the ranks in terms of trust. So I think they're still perceived to be the most are the most trusted. We do know that there have been a number of health professionals around the COVID vaccine who weren't big fans of the vaccine or had their own anxieties. But I think overall, and that there's a lot of trust in healthcare professionals, and they were working to build trust. But I think that what is needed is that it needs to get out of the clinic, out of the health center, and brought into other domains, and to build some champions, some local champions, some networks. We've seen in a few settings, we work with Africa CDC across Africa, and then work with a lot of local situations. And sometimes people just didn't have the information, or all they had was some social media. And it took a doctor coming into the community or sitting with a group after church or after whatever gathering, and just having an informal chat for questions. Health professionals are hugely respected. And I think to bring that into forums outside of the typical health clinic is really important, to the extent that you have that opportunity.
Thank you, Heidi Larson. We're discussing COVID-19 vaccine confidence, and this is ahead of Teach to Reach Connect 6. Now, on the 4th of March for Teach to Reach 5, 8,584 health professionals from all over the world joined us, and we're now getting ready for the 6th edition, where we expect even more health professionals for this 6th edition on the 17th of June. This time, and for the first time ever, your colleagues who do not work in vaccination, who may work in primary healthcare, who may work in other areas, other disease areas, other areas of work, even beyond child and maternal health, will be welcome to join Teach to Reach for the first time. And in fact, we'll be holding a plenary session focused on neglected needs of women's health, looking at the neglected tropical disease that is female genital schistosomiasis, affecting an estimated 56 million women and girls in sub-Saharan Africa. But to come back to our focus today in the discussion with Heidi Larson, we've partnered with a zero-dose community practice, and we'll be holding an event that will be led by the Women Who Deliver Vaccines Collective during Teach to Reach, looking at examining, exploring, reflecting, sharing experience of how to overcome gender barriers. And then on the specific topic of vaccine confidence, the Geneva Learning Foundation will be launching our report, really what we learned from the experiences of 734 of you who took time in November, December 2020, when we did not know what the vaccine characteristics were going to look like for COVID-19, took time to reflect on your experience, how you have actually overcome barriers to vaccine acceptance in the community. And we still can't announce it, but we are looking forward to, in the coming days, to announcing a new partner for Teach to Reach that will focus on promoting vaccine confidence. Now, this is what we're doing on the 17th of June, but we actually want to rewind and look at what we learned on the 4th of March 2022 at Teach to Reach 5, in which we invited you to network to connect with one another and to discuss how you have actually, in your daily work, overcome COVID-19 vaccine hesitancy, how when confronted by an individual or group who was reluctant, who was fearful, who didn't understand, didn't have the information, whatever the context may have been, how you actually move that individual or group towards acceptance. And these now are examples of what Teach to Reach participants said they learned from that networking session. Charlotte is going to present a few of the testimonials, and we'll be turning to Heidi Larson and to the Immunization Agenda 2030 leaders who are with us in the Zoom studio, as well as those of you who are listening to via social media to comment, reflect, and share what can we learn from this learning. So let's start, Charlotte, with Jean-Félix MUBAYI KAMONO, who is an international consultant working across a number of countries. What did Jean-Félix say? What did he learn from Teach to Reach about COVID-19 vaccine confidence?
He said, during the networking experience sharing, I was convinced to get vaccinated to educate other colleagues and family members and the public. I got real scientific answers about COVID-19 and the different types of vaccines. I got around the rumors about vaccines.
So I thought this was really interesting because here's an international immunization consultant, and he says that what managed to get him to the point of actually taking COVID-19 vaccine for his own health was discussing it with colleagues, peers at Teach to Reach. Now, he cites the scientific nature of the information received, but this was an informal context, people sharing experience. Heidi Larson, what else do you think factors in when health professionals share experience with their peers around this question? What is important or significant in this testimonial from your perspective?
Personal stories are always the most compelling to people, particularly with healthcare professionals. I mean, one of the first things they want to know from their health professional who's encouraging a vaccination is either, did you take it, or would you give it to your child? So, I mean, if you have your own story about that, it's pretty important. But also what we've learned a lot, it's never just about the facts, it's who you're getting them from. Do you trust them? Is that what your issue is? Because sometimes we give information about a vaccine that is not where the questions are. So I think it's important that we make sure that the information we give is relevant to the questions people have. But it's a good story.
Thank you, Heidi. Let's go now to the second story from DJIRI, who is a man, works in Burkina Faso at the district level for the Ministry of Health. And this is what he learned from Teach to Reach 5, in which colleagues from all over the world shared their experience of how to actually in practice overcome a COVID-19 vaccine. Charlotte, over to you to share this story.
The different experiences of the people we met were very enlightening. The initiatives used to gain acceptance of the COVID-19 vaccine, that is vaccinating oneself before inviting others to vaccinate, the communication strategies for social behavioral change, the accountability to health workers and the population, for me were experiences that made the effort in this context of vaccination against COVID-19 resilient.
So Heidi Larson, in Teach to Reach, leading by example has been one of the recurring insights from health professionals who say, when I showed others the way, that was one of the most compelling things that I was able to do, that helped people understand and move towards acceptance and gain confidence. In some countries, we know that a significant proportion of health professionals have in fact been reluctant to get COVID-19 vaccine themselves. How closely does this correlate with the level of COVID-19 vaccine confidence across sort of the broader population, not just health professionals? And you already answered this, but again, it's worth asking, are health professionals still the most trusted advisors when it comes to COVID-19 vaccination?
Yes, they are. And what's interesting is there was a recent piece of research that came out that was measuring what the public perception of healthcare worker trust was versus what it really was. And in some populations, people have this impression that even healthcare professionals are not vaccinating, are questioning this, which there are some individuals, but they had a perception that it was a lot more than it was. And next to that, they measured the real trust among healthcare professionals, and they used the public perception in this particular country was 50%. The public thought only 50% of the healthcare professionals trusted the vaccine, when in fact it was 95% in the survey with the national healthcare professionals. And they used that data, about 95% of the healthcare professionals trusting and believing in this vaccine, changed people's minds. So to the extent that you can, come together more than as an individual, but as if you have a local health professional network, or if the Society of Health Professionals comes together, the more you have strength in numbers, the more compelling it is.
So we have a comment via YouTube from Tilahun Negasa. Tilahun, please tell us what city, country you're connecting from. What is your experience? How are you involved with COVID-19 vaccination efforts? And Tilahun says vaccination is well known and accepted in developing countries. The challenge, according to Tilahun, is reaching all eligible, not developing confidence among people. And what makes a difference, according to Tilahun, is the age group. So the fact that adults are a target for COVID-19 vaccine. And he wonders, why bring up this question of confidence? What's your response, Heidi?
Well, the reality is the COVID vaccine was not well accepted necessarily in less developed countries. There was resistance there in the same way there was, it depends where you were in the world. So the usual differences that we've seen with childhood vaccines and more routine vaccines was totally different with COVID. But there was also a change, and a pretty dramatic change. We've been monitoring confidence in vaccines across Africa, as I mentioned, with Africa CDC since 2020. And there was much more optimism and willingness to say, yes, I would take a COVID vaccine if it was recommended and it was safe. But over the last 2 years, we've been monitoring willingness, and that confidence has really dropped. And I think some of it is because of the frustration of not even getting the vaccine. But in the meanwhile, there's been a lot more information, positive and negative, circulating. So I don't think we can I think we need to build confidence, and not just build it, but sustain it, because it's very vulnerable. It goes up and down. And so I think we need to really look at local situations, because I think absolutely true that in general, vaccination is widely accepted, childhood vaccination, particularly in lower income countries, and has stronger, more outspoken pockets of resistance in higher income countries. That I agree with. But in the COVID situation, it was really different.
Thank you, Heidi. Let's look at one final story. So we're looking at what participants, health professionals from all over the world, learned together by sharing experience with each other about how they have, in practice, overcome COVID-19 vaccine hesitancy. And Chidima Joanna from Nigeria works at the subnational level, is part of an NGO, a non-governmental organization. Charlotte, what is the story that she shared? What did she learn from Teach to Reach?
I learned that people react differently to things, especially concerning the COVID-19 vaccine. Some feel it's a waste of time, while others think it's a necessity. I'm not able to see clearly, Reda. What I will do differently is to ensure that I communicate effectively with those who haven't taken the vaccine, and ensure I guide them on its importance.
All right. And so Chidima recognized the differences in attitudes and decided, following Teach to Reach, that she would try to better tailor her communication depending on the attitudes of the person or the group she's addressing. Heidi Larson, what do you think of this strategy? How can health professionals involved in COVID-19 vaccination sort of better assess the different types of attitudes and sort of tailor responses to them? Is that an effective strategy for health professionals to adopt?
Absolutely. And I would say in her comment, she talked about communicating more effectively, and a big part of that communication is actually listening. And if she's, it sounds like she indeed is listening as part of that communication. And that's really important, because one of the complaints, concerns, frustrations that we've heard from publics in different countries around the world is that what the health system, whether it's the local health ministry or the regional, WHO or whatever health institution, the information they put out there is what the institution thinks is important and is certainly important, but it doesn't always answer their questions. And they need some local responses to their questions, because maybe they've read all the general information but they still have a question about X, Y, or Z, and sometimes it's just not available from official sources, and they need somebody to help build their confidence. And it's exactly that kind of conversation that we just heard about that can really make the difference for someone who generally thinks, maybe I should, but I'm still a bit anxious. And if she comes along and said, what are you anxious about? Actually, that's it's important you take it, don't worry. And has that personal connection.
Heidi Larson, thank you. Thank you to the IA2030 leaders who were with us in the studio today. This is just what we call a lightning chat. No more than 30 minutes to begin exploring a topic, to sort of scratch the surface and enable you to answer the question, is this of interest to me? Do I want to go further? This lightning chat was prepared by the Geneva Learning Foundation's Insights Unit, and this is ahead, of course, of Teach to Reach Connect, the event that will be taking place. The next edition, this is a quarterly event. The next one will be on the 17th of June, 2022, with a number of topics on the agenda. Not limited to immunization. We will be, for the first time, welcoming another of the Geneva Learning Foundation's communities focused on neglected needs of women's health, and specifically female genital schistosomiasis. We've partnered with the Zero Dose Community of Practice from Gavi and the Immunization Agenda 2030 Working Group on Coverage and Equity. We'll be launching the report documenting key learning from the experiences of 734 frontline health workers in tackling COVID-19 vaccine hesitancy. And as I said earlier, there's also a new partnership to promote confidence in vaccines. On the 17th of June, the Women Who Deliver Vaccines Collective will be here, and this is all part of the movement for Immunization Agenda 2030. So currently reaching 44,919 immunization professionals active on the platform. This is not only about what we share with you, it is also about what you share with each other. There is a cohort of more than 6,000 participants who are nearly finished with the first full learning cycle, a continuum of action from knowledge to impact. In the last few weeks, this number has grown to more than 8,300 people currently working together in the Impact Accelerator to make a difference around a specific strategic priority of Immunization Agenda 2030. 4,139 people who are currently working together in the accelerator, and you're all invited to join us on the 17th of June for Teach to Reach, to continue this discussion with global experts as well as global partners, and of course with your colleagues from all over the world. Thank you, and goodbye.